What's your opinion on the role of faith in the healthcare system?
So first of all, faith is personalized.
Okay.
So, faith is one's belief in a force somewhere.
Okay.
So if I believe that I'm well and I take that into heart, I think I'll be well,
Do you think your local pastor can pray for you and then upon malaria, for example?
As long as sina hiyo faith, sina hiyo imani, I don't think naweza pona. Na pia mimi naamini naweza jiombea na hiyo imani.
So where is the balance? Where does the balance stop? Does the balance stop with like tuberculosis? Do you think someone can pray over you then TB pone without the conventional drugs?
Sasa hapo ndio kizungumkuti.
So are you saying that there's a limit to faith?
Yeah.
Is there a limit to faith?
So, I'm like, if I have stage 4 ovarian cancer, nitaamka tu niseme nimepona, niishe ama.
Now that's the question to you now.
No, that's a tough.
No, actually I've seen HIV people. What wanapona HIV? Is it true?
Maybe hawako nayo originally.
So pastors
alisema wamepona.
Actually these guys have doctors like you who are there to do the HIV test.
Who confirm that the patient have
So you've seen one?
I've seen on TV.
Have you seen any patient who you had like a follow-up when you alipona HIV yourself, daktari?
I've never seen. And all I can say is if a pastor could pray for that one person and heal them, see, we then employ them in our hospitals. We need to decongest this hospital. For sure.
Yeah, the medical ward, I don't know.
I think we could be paying them actually.
Sindio?
One patient, 10,000. Unamheal akisonga.
Afanya hip replacement. What's also?
Madawa za HIV ni mingi for a lifetime. Na kuna pastor anaombea watu wanapona. Wakwe kwa employment.
Anyway, so to all pastors out there, I mean, it's okay to have your followers believe in faith and whatnot, but please never tell a patient to stop conventional medicine because you will pray for them and that utawalipisha 10,000 wanunue kuku ya color green and a blue, I don't know, whatever, and then you'll be able to heal them. I think that's very wrong. And some pastors actually send patients to an early grave, for example. I've seen patients who stop like HIV medication, then come back at a really, really bad state. Stop cancer drugs, come back at a really bad state. So I think if you can blend the science of today plus your faith, that would be very good, because also faith helps you heal. Because if you have hope and whatnot, you can really push it through like chemo and whatnot. Because chemo is also very, very tough, and like the whole burden of disease. But just a pastor saying that tutakuponesha ukinunua maji ya sijui 200, 500, I think that's very barbaric, and anybody who says anything remotely close to that needs to be arrested. That's just my opinion. Very strong though, but I believe that is playing with the lives of Kenyans. If anybody can tell my parents that you have a stroke and don't take medication because I'll put my hands over you, I think that's a very evil person.
But I associate that with poverty.
For sure. I think poverty also opens up room to be gullible, because if you can't afford medication, particularly things like diabetes and hypertension, which require you to like take medicine every single day in your life. So if someone comes and tells you like for 500 bob only you'll be out of this mess, I think that really opens up room for such kind of malpractice and whatnot.
Because most patients that I've seen that have stopped medications because of their pastors, most of them are poor, and they tend to tell us that they went there because they were hopeless, and they were told that when you're there you will see heaven, reward. So most poor patients are likely to be. I
think I am a poor patient, for example. I can't even afford like medical services, to be very honest. If today I want to break like my femur, need a femur replacement, mtanichangia pesa, mimi sina do. Because now you see healthcare is very, very expensive, and I know most doctors who, if they were to be diagnosed, for example, with a brain tumor, will not be able to afford like the kind of treatment it is. So I think with regards to healthcare, unless you're like a politician or like a really like wealthy guy, I think all of us are essentially poor when it comes to healthcare.
So like I say, be aware.
For sure, be aware. Please. And then if whatever your pastor is telling you, kama yeye mwenyewe hawezi the same thing, please don't trust him. By the way, if his mother were to get like a brain tumor and maybe as he seek conventional methods, then trust him. Otherwise, use your common sense. Karada.